A Slidell mother was hoping for a chance to try an experimental treatment to save her life, but she kept facing obstacles that may have taken away her chance for survival.
It's a battle that many others in her situation are facing. They don't have access to the latest medical treatments. Well, tonight, medical reporter Meg Ferris has the story of how the system continues to fail a cancer patient who's running out of time.
It's a bit harsh right there, you know.
It's a moment in time most people might take for granted. A parent sitting at the dining room table, helping a child with homework, but not for single mom of 3, Nicole Harris.
It is the hardest part. It's very hard. It breaks my heart. I feel like I'm failing them.
It all started with back pain 2 years ago. Nicole was told it was arthritis. Several months went by. She started going down.
At that time, I couldn't walk. I couldn't bathe myself. I couldn't do anything.
Then, from blood work and a bone marrow biopsy, the long-awaited diagnosis. Were you scared?
I was terrified.
Tell me why you were so terrified.
Because it's cancer.
Multiple myeloma is a cancer of the white blood cells called plasma cells. That's what fights infections by making antibodies.
They told me that if I was going to have cancer, this is the one to have because it's very treatable. And so that gave me a lot of hope that it wasn't going to be this bad.
There was radiation, chemo, and a stem cell transplant. That failed immediately. Then more chemo and more chemo, 8 treatments in all. Then new hope, a clinical trial at MD Anderson in Houston. But soon, those hopes vanished.
There's no way I could come up with that kind of money. I mean, I'm sitting here with a treatment that could give me years, right in my grasp. And I couldn't have it.
You see, Nicole is on Medicaid. Being this sick, she could no longer work cleaning houses with her friend. The initial assessment in Houston was nearly $40,000. Medicaid would not pay because it was out of state. Through a chain of emails forwarded several times over, Medical Watch learned of Nicole's desperation. We reached out to the LSU Health Cancer Clinical Trials Program.
The state of Louisiana has poorer outcomes than the rest of the country with respect to a variety of cancers, and much of this is due to access of care.
Dr. John Stewart has come back to Louisiana as the director of the LSU LCMC Cancer Center. His goal is to create a system that gets rid of health disparities in cancer care.
I think that it is unacceptable that a patient has to leave the state to get care for complex malignancies. And so one of the drivers for our cancer center is to offer state-of-the-art multidisciplinary care for cancer at home.
The LSU Cancer Research Center is already home to many national clinical trials with the latest investigational treatments. Dr. Stewart wants to grow that program. And that's where hope was reborn for Nicole. LSU doctors lined her up with that same clinical trial in Houston, opening here in New Orleans.
It gives me hope. Like I have a chance to be with my kids for a little bit longer. Instead of 3 months, you know, I could have 3 years.
But just days ago, again, the hopes were shattered. In that many-month delay, Nicole's plasma cell numbers had plummeted. Even though the clinical trial is now in her own backyard, she no longer qualifies for that new investigational treatment. She's running out of time and is already out of money.
I've been trying for 1.5 years just to get disability. I haven't even been able to get that yet. I was approved medically, but not financially because all the stimulus payments were in my account. And so I had to start all over again. And they said it could be 5 months or more.
But if the doctors are right, she doesn't have 5 months. Multiple bones are breaking. There's excruciating pain. Nicole's mother has moved into her Slidell home to care for her. What's getting you through this, Nicole?
My kids. Yeah. I don't want to leave them.
Do you get sad sometimes?
Mm-hmm.
And so tell me, how do you get through that? How do you cope with that?
I will just, I guess, sit in my room and, I guess, hug a pillow.
It's driving her oldest, a senior in high school and really the man of the house, to focus on grades and get into LSU, then to veterinary school. Where does that resilience come from?
My mom and my mama, they're both hard workers.
And while she can watch those 3 children with tremendous pride, Nicole now waits for a last chance at hope. Doctors want to change her chemo medicine. It has a 10% chance of helping. But for nearly 2 weeks, doctors have been waiting for Medicaid insurance approval. 2 weeks, that's an eternity in Nicole's life. From Slidell, Meg Farris, Eyewitness News.
Well, Nicole now has lymphedema in her hip and leg. Now, that is a buildup of fluid when the lymph system is blocked. The earliest a doctor can see her is 2 weeks from now. If you'd like to help her family, we have that information on our website, WWLTV.com.